This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for extract 1. Extract 1, questions 1 to 12. You hear a doctor in an emergency department talking to a patient called Gail Kennedy. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Mrs. Kennedy?
Yes.
I'm Dr. Jarvis.
Hello.
Sorry to keep you waiting.
Okay.
Now, can you tell me what's brought you here today?
Well, I got back from holiday 2 weeks ago and I've been feeling awful ever since. It was a long-haul flight because we'd been to South America and when I got back I felt awful. I thought it must be jet lag, but brutal, much worse than I remember having before. Anyway, I thought I'd get over it, but it actually got worse. After a few days, I was getting bad chills and non-stop shivering and achy muscles. I just felt lousy. I mean, normally I'm pretty healthy. I don't get a lot of illnesses. So I started to worry. I thought maybe I got meningitis. Right. So I rang the doctor. When I told him where I'd been, he said I should come in and see him because it might be malaria. So I said, well, it can't be because I've been taking Malarone. I started on that 2 weeks before going away. I tried Lariam a few years ago, but it gave me really odd dreams, so I didn't want to take that again. Anyway, the doctor said some sorts of malaria are resistant to these drugs, and I know I did get a few bites when we were there. He gave me some pills to take for 3 days, just in case it was malaria.
Right. Can you tell me what they were?
Oh, Art something.
Artesunate.
That's right. And something else. Hang on, I've got the box here. Mefloquine.
Okay.
So I went home and I took the pills, but I didn't feel any better. In fact, I got worse. I felt really weak and I was sweating buckets, just dripping with it. I finished the pills yesterday morning. Since then, I've been really bad. I haven't been able to keep anything down. I was throwing up all day yesterday and had the most splitting headache. I've never had anything like it. So I rang the doctor again and he said the blood test had come back negative. But if I wasn't feeling better today, I should come into the emergency department and get some more tests done.
Right. Well, I'll just do a brief examination.
Okay.
You want to pop over there? Okay, so your skin's a good colour. I can't see any sign of jaundice. And your breathing's sounding pretty good. You haven't had any episodes of breathlessness, have you?
No. But yesterday, my heart was really racing.
Yes, there is some evidence of that now.
And something else. All this week, I felt as if there was something scratchy in my eyes, like sand or something, and they feel really dry.
I see. And have you had any abdominal discomfort?
Well, there's no pain, but I don't have any appetite. I can't really keep anything down, like I said.
Right. Now, apart from taking the anti-malarials, did you have any vaccinations before you went away?
Yeah, I had all the injections. Typhoid and what else? Not yellow fever because I'd already had that before. But I did have one for hepatitis A.
Yeah.
And they were fine. I don't usually have any problems with things like that. Then while we were away, I did get cold sores all over me upper lip. I've had them before and I'd got some over-the-counter stuff for them, so I just used that.
Right.
Apart from that, I was fine during the holiday. I'm normally very healthy.
Uh-huh.
I did have breast cancer a few years ago. That was in 2011. I had a lumpectomy, so I was taking tamoxifen for 5 years. But I don't have to take it now.
Okay. So it's possible that this might be a reaction to certain drugs, but we'll need to do some more tests first.
Extract 1. Questions 1 to 12. For questions 1 to 12, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes.
This is a Benchmark Education Solutions. Extract 1, questions 1 to 12. You hear a GP talking to a patient about an ongoing problem. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
How are things going today?
Well, not so great, but please do call me Jake.
Okay, Jake. So, I see here that you made an appointment because of general malaise and lack of appetite.
Yes, I've been feeling off for about a week. I vomited on one occasion and I've been feeling a bit feverish.
Okay. Do you remember seeing any blood in the vomit?
No, not that I can recall.
Have you been experiencing any other symptoms over the past couple of weeks?
Yes, I have. For about 2 weeks, I have had these aching pains in my knees, elbows and wrists.
I see. Your joints don't look swollen at all. Okay, any changes in other areas, such as in urine output? What about bowel movements?
No changes there.
So, I want to do a bit of medical history and your overall health. Have you had any infections over the last several years?
Yes, about 5 years ago, I had glandular fever.
Okay, and your overall health? Are you a smoker or drinker?
Yes, I definitely am. I smoke about a pack of cigarettes per day. so about 25 or so, and I drink 4 to 5 beers a day, sometimes more on the weekends.
Yes, that qualifies as being a very heavy smoker and drinker.
Yes, I know. I'm also a recreational drug user, marijuana and sometimes ecstasy, that type of thing. But not too often. I mean, I am usually up for whatever drug is being handed out in the club.
Any intravenous drug use?
Oh no, nothing like that. I can't stand the sight of needles.
Well, I see that your temperature is a bit high at 38.6, and you appear to be a little jaundiced.
Do you mean a bit yellow?
Yes, that is what I mean. It often indicates a problem with liver function. Your physical examination showed you to be a little tender in the right upper quadrant of the abdomen. I'm going to need to order some blood investigations. We need to check for liver function and infection in general. The diagnosis I'm looking to confirm is acute viral hepatitis.
I have some friends who have had that. Aren't there different types of hepatitis?
Yes, there are. There are hepatitis A, B or C. The cause of hepatitis A is often eating or drinking something contaminated. You haven't travelled outside of Western Europe recently, have you?
Definitely not. I'm currently unemployed, so no travelling for me. I think the last time I left the country was 4 or 5 years ago.
OK, well, certain behaviours such as homosexuality and intravenous drug use are risk factors for hepatitis B and C. With hepatitis B, there are often joint symptoms, so that is the most likely diagnosis.
So what would treatment look like? I mean, is this something that would affect me the rest of my life?
Well, that depends on the investigations. In the meantime, you should avoid alcohol and drugs as they can further have a negative effect on liver function. I want to set you up with an appointment with a counsellor to talk about your alcohol and drug use. How does that sound?
I don't know. I mean,